The island of Caye Caulker is bracing for an economic downturn, but is doing its share to fight the COVID-19 pandemic. The Ministry of Health has been advising the public on best practices when it comes to hygiene and social distancing as preventative measures to be taken. A Caye Caulker Health Committee has been formed to stay on top of the issue. Chairlady Selene Villanueva-Pot says that hand sanitization takes place when persons arrive and depart the island.
We've also set up hand sanitization of all ports of entries to Caye Caulker. So if you come on the plane, you'll be handed hand sanitizers. Before you're boarding the boats, you're being handed hand sanitizers. On both water taxi ferries, you're supposed to be given hand sanitizers before you reach the island. This week we have a second phase that we will implement, which will be fumigation of luggage. We've seen a drastic decline in tourists due to all the bans that are being put in place. Safety is first, and for us it's taking care of our community. Hence the reason why we decided to be proactive.
With that, the committee has established a hotline for residents as well as tourists to contact the medical team in case of emergencies.
We've decided to create a hotline number where if there's anybody experiencing any symptoms and if there are visitors on the island, because we still have visitors on the island, if you notice a cough or shortness of breath or fever, anything of that, you call the number, get the information from the proper health personnel, and then we move from there. If the nurse or the doctor needs to do a triage, it's done over the phone, and then we make movements from there.
There are 2 doctors and several nurses currently installed on the island. One of the doctors is in private practice while the other is manning the medical center. Dr. Salim Mani says that only persons with non-communicable diseases will be treated at the medical center. Others who may be exhibiting respiratory illnesses will be taken care of through distant management.
Distant management and consultation. We do not want they come. We have our hotline, through that they call me. Call the next doctor. We have 2 doctors. We have one in private, one in the government. Then we discuss the case. Corona, COVID-19 is like flu. It's like common cold. All the medication they will receive is over the counter, so no need to come. They can go to a Chinese store, they can go pharmacy and buy them. I will give them a guideline, you are adult, you are children, what to do. Let's start from the viral grip. Viral grip is for adult and the children. You can adjust the dose and start at home. Get your liquids, Pedialyte or a hydration salt. No need to come and see us. No need to come and contaminate the area for the clinic.
Dr. Salim also shared the best advice for islanders.
Coronavirus is a heavy virus. Maybe 3-4 feet after sneezing, it drop where? In the surfaces. So best advice is don't touch. That's number 1. Number 2, just no more communication, no more gathering, no more kissing, hugging, touching each other. Not to be in the public. Let's say you go ATM machine and withdraw something. Be careful, you are touching, somebody touched that. Handling the money, you have to be careful. Public area, that's just the shortest I can say, no touching. And stay at home.
Duane Moody for News 5.